Yoga has transformative properties. Today in the podcast, I had an amazing conversation with Lindsay Watkins. She is a fellow BCBA, and she shares in her life story that she had something very traumatic happen, and she utilized many avenues, but yoga was very, very transformative for her. And she is talking today all about how she became a yoga teacher, and she's a board certified behavior analyst, and how she is blending the two beautifully. I may add, this is right up my alley. I really love movement. I really have utilized yoga in my therapy sessions. When I was working with middle school and high school students, we would do yoga at the end of our sessions as a modified leisure activity. And I just think that it's such an amazing way to work on a variety of skills. So today in our episode, you are going to learn what are some of the skills from yoga that you can incorporate into your sessions. She talks about how it meshes with the ABLES-R and the VB map. And if you're a speech therapist and you're like, what are those assessments? Just early learner skills as well. And we're going to talk about the benefits of yoga, not only for our students and our clients, but for ourselves as clinicians. Yoga can be absolutely transformative. Thank you to Lindsay for sharing her personal life story with us. It's very, very powerful, and I can't wait for you to get into this conversation with myself and Lindsay Watkins. I'm Rose Griffin, a speech therapist, board-certified behavior analyst, and founder of ABA Speech. It wasn't all that long ago that I felt overwhelmed by providing therapy for my autistic students and any students who were not yet speaking. Fast forward through many doubts, tears, research, and courses, and you will see the framework that I use today and share with over 60,000 readers weekly. One that will help you support your students and feel more confident in the process. I created the ABA Speech podcast to give you simple, step-by-step strategies to help you reach all of your students wherever they are on their communication journeys. If you're a speech therapist, BCBA, RBT student, or parent who's looking to help all students develop a way to communicate with the world, you are in the right place, friend. Let's get started. Welcome to the show. We have with us Lindsay Watkins. Thank you so much for joining us today, Lindsay.
Thank you for inviting me. I'm so excited to be here.
One of my joys with the podcast is, I started this podcast because I like to talk to people, and I just honestly had been on like every podcast in my niche, and I was like, I want to have my own podcast and find people myself that I want to talk to. So I do that as a task in my little project management once a month, and I was perusing LinkedIn, and you popped up being a yoga teacher and BCBA, and I am somebody, I honestly probably do yoga 3 times a year, but I love reformer Pilates. That's kind of my jam.
Me too.
Do you? Okay.
I go mostly Pilates these days, but I usually go to yoga 2 or 3 times a week. I love both of them. Yeah.
Yes, I love it. So anytime I see somebody who is a yoga teacher, yoga instructor, I just know how hard that is to be. And obviously I know how hard it is to become a BCBA because I am one of those. So I'm like, wow, anything that incorporates those things together, I'm always really, really intrigued. Yeah. So can you tell us a little bit about what came first, like yoga instructor, BCBA, and just your journey to both of those?
Yeah. It's funny you asked that because they actually both go really hand in hand for me. It's actually a pretty personal story. So I was kind of debating how much I wanted to share, but I think this is going to be helpful for somebody. So I initially started in the field as a special ed teacher. Yeah. I did that for a couple of years. I was like, this is just not for me. Yeah. And by that time, I'm like 25 years old. I'm kind of like soul searching. What should I do with my life? And I discover ABA. And I'm like, you know what? This is what I'm going to do. I don't want to like beat around the bush. So I started like right after I finished teaching that summer, I started my master's program, and I started accruing hours like right away. That same summer, I experienced something really traumatic. I won't get into details, but it basically changed the trajectory of my entire life.
Wow.
And so, if you don't know anything about trauma, like I didn't at the time, it's basically a pressure cooker in your body. Like if you don't do something about it, it's just going to keep boiling up until like one day, you pop. And so that fall, I switched from working in a clinic to working in home with the Autism Society, kind of different population. And because I was a student, they gave me the more challenging cases. So I was working with two older teenagers with high rates of aggression. And so I had just experienced this trauma. I'm shoving it down. And as you can imagine, working with high rates of aggression when you're kind of in that state, really, really challenging. And so it got to a point where kind of like something snapped, and my whole life changed. I ended up being diagnosed with post-traumatic stress disorder. I had really severe insomnia. I was sleeping like maybe 3 hours a night if I was lucky. If you don't know anything about like trauma, like I said, I didn't, your body really retains like an imprint almost of the memory of the trauma. So like, you might not even remember you saw someone in a gray t-shirt, and then like 6 months later, someone in a gray t-shirt walks in the room and all of a sudden you can't breathe. You feel like you're having a heart attack. You're having a panic attack. So that started happening to me. I was totally like, I was doing great at work and I really wanted to be there for these kids because I felt like I could relate to them so well. It was like something that felt really small to them was triggering them, and suddenly they were engaging in aggression and they didn't have the language to express what they were going through. And I felt so much empathy for those clients because I was like, I have so much language and I can't even express what I'm going through between clients. I'm driving between clients. I see a cop car and my heart rate's at 200. It was just like, it was a mess. So I went to the doctor. I got, I tried medication. I, went to therapy, all that. But it was still like every day I was just trying to make it through the day. So it was a really challenging time. And then I discovered someone in my area that does yoga therapy. And basically she was licensed clinical social worker, something, also yoga therapist. And she was just phenomenal. Her name is Nina B. Nina B.E. So look her up if you're in the same boat that I was in. She's phenomenal. But she basically had these weekly sessions where a bunch of people would come in. It was like, I think like 8 people. And we would do pranayama, which was breath work. We would do meditation. We would do movement yoga. And then we would do like group therapy. And this like completely changed the game for me because I felt like so much relief, like immediately. Like this worked better for me than medication and therapy and all the things because it combined all of this stuff. And so I kind of vowed to myself in that moment, like, I think if I could figure out a way to apply this to my clients in the future, like I knew it was going to be way down the road because I like wasn't even to the point where you could ask me how I was and I could answer you honestly without breaking down or whatever. But I was like, you know what? I want to figure out a way I can do this. So then, of course, a couple of years later, there's a pandemic. Things, my mental health gets, crazy again. And then, 2-3 years ago, I really got to a good place. I, no longer meet any diagnostic criteria for PTSD. I'm living a life that's even better than the one that I had before, which never thought that was possible. And so I started looking into becoming a yoga instructor. And so I did it. I actually did it via telehealth, finished that up last May. And then I've been working on creating CEUs and coursework for other BCBAs, and then kind of working with some of the clients that I work with currently on kind of trying some of these strategies. So this is really a new venture for me. I just started teaching CEUs within the last few months. So my first one was earlier this year, and then I have another one coming up May 1st. I'll try to put another one out for right after this is released so that maybe some of the listeners can also join. So the journeys were kind of like interconnected, but you're right. A lot of work, a lot of field work, a lot of accruing hours on both sides.
Yes. Oh my gosh.
And so finally in a place where I've got all my hours and I'm in a good spot now. So I'm really excited to kind of bring this to the forefront. And I think this can really help some people, not only clients, but, I'm hoping by hearing my story, I just like, I feel so like rooted in the fact that, people who work with this population really need to take care of themselves, both clinicians and parents. We are constantly, burning at both ends. And if you're not taking care of yourself, it really bleeds into the care that you're able to give to the person that you're working with. So, not only teaching this skill to clients, but also practicing it yourself is super, super important. And it can make you feel so much better and just, be a better clinician and a better parent, caregiver, and all of the things. So
Well, thank you
that's
so much
my
for
long-winded answer to that
no,
question.
I love it. Thank you so much for sharing that story. That's very impactful and I think will help a lot of people. And I think that people don't take time for themselves. And I think
Yeah,
that that's so important. And I love the idea that you're putting these things together. I feel like I don't know a lot about ACT, acceptance and commitment therapy, but just have people on on the show and then also having them do some CEUs. But I had a fellow BCBA on, I believe she's a yoga instructor. Her name is Kate Nasuti. I don't know if you've ever met her, but she's cool. And
love it.
she talked about how she was a clinical director and how her day to day just did not feel aligned with like how she wanted to really live her life. And so she's doing some different types of things now, but she became a yoga instructor. And I think just being able to share how impactful that was for you. And well, this Nina B, she sounds like a very special person who was offering something
Yeah,
very personalized that changed your whole life and is
totally.
really, you're going to be able to help so many other people and probably already are with putting this
Exactly.
together. And I think kudos to you because I feel like doing something that's outside of the box is very hard. And
It
I
is.
just had Dr. Shane Spiker on. I don't know if you know Shane Spiker. He's really cool and he's very smart. He's PhD, but he just talks about, doing things that are kind of outside of the box and thinking that just because it's ABA and, there are other professions and there are other things that could
Totally.
potentially help to inform our clinical practice, which is exactly what you're doing. And I love that. I was telling Lindsay that we had two women from Talk Yoga, I believe it is, on the
Yeah,
first season. They're speech language pathologists who talk about using yoga and speech therapy. And I just think, I think it's great because there's a lot of BCBAs who don't like to hear the terms like regulated. I say ready to learn. And, there's a lot of sensory talk in the speech therapy world. And I've had my occupational therapy friend on who's a PhD, but I think these are all really important things to validate as humans, right? Like we're not always
totally.
ready to learn. We could do a couple things. So what I was interested though, you talked about that there was an article published in JABA about something that talked about yoga being helpful. And I was just wondering if you could share more about that because I was interested in that.
Yeah. So the research, as you can imagine, just like you're alluding to with thinking outside of the box, the research is pretty limited in the behavioral health space
Mm-hmm.
as it pertains to ABA. There is one reference to a study in an article in JABA. It's from 2011, so
Okay.
pretty old. That had to do with measuring self. I think it was like self management techniques and then also social skills.
Okay.
So essentially measuring like an increase of those two skills. Primarily the research that I found when I was starting to develop my CEU, a lot of it is in the psychology realm. And
Mm-hmm.
so there's a lot of research in there with a little bit more information about specific 10-week studies, 12-week studies that
Yeah.
measure baseline levels of aggression, self-injury, those types of
Oh.
behaviors, and behavior reduction as it relates to kind of some of these proactive or antecedent strategies versus like more of the reactive. So if you're thinking of, your ABC data,
Right.
instead of focusing on the C, the
Mm-hmm.
consequence, getting some of those proactive strategies. It is so tough though with ABA because, these payers lately have been cracking down so hard on coping strategies and things like that.
Mm.
And this falls under the OT umbrella, or we can't work on the X, Y, and Z. So what I did in the CEU, and this kind of ties into one of the other questions I think that you had asked, was I found a way to make some of the yoga skills that you're teaching tie directly to the ABLES, directly to the VB map, following
Cool.
some of those specific like targets that are already in the behavior plans that we have that are existing. So
Mm-hmm.
things like motor imitation, instead of working on touch head, maybe we're doing mountain pose, which is literally
Right.
just standing there with your hands facing forward.
Right.
That's a much more functional skill than, you're walking down the street. Okay, stomp your foot. Okay,
I
you know
know.
what I mean? Like those
I
types of
know.
things.
Uh-huh.
And tying them to things like listener responding goals or following directions in a group setting, or social skills you can definitely do if you're able to take the kiddo into like a group beginner yoga class or something like that. But there are ways that we can do it. And we are in need of more research. So I'm also like, if anybody listening has a client in mind and they're like, you know what, this could be good for my client, like, please reach out and we can try to put something together, because we are lacking in research, and these things are rooted in behaviors and observable behaviors, like that. So yeah.
Yeah, I love that. I think that is really smart. I did when I was in the schools, I worked in the middle school, high school. I still am a treating clinician 2 days a week, but when I was really like doing groups and things like that, I always joke because I was like, I really did think when I was in my 20s that I would be an aerobics instructor on like some level. I usually have like 20 jobs. So I thought like that would be something that I would do someday. So I always joked because I would run these groups and the general framework was like, okay, let's do like a question of the day. And then let's do a literacy based activity. And then we'll do a modified leisure activity. So these were, rooms I was going into where the learners were autistic and varying abilities, communication. And so we would do a yoga unit, but my OT had these really nice yoga cards. So we would put on YouTube. Somebody would turn the lights off. We'd dim the lights. We put on some meditation music. I would do like a pose, and like it was very cute. And what was neat about it is it's fun to see the kids doing all that. What was cool about that, it was about 30 minutes from my home. And in that community, they had a really nice community center that had classes and some yoga classes too for people with disabilities. So I was like, oh, this is so cool because I'm teaching these group skills, right? And like that's what we're taking data on, being engaged in the group. And then they can generalize it to the community. And what's so cool about yoga is that it's a life skill. Like, because you have like the Cosmic Kids yoga, which I've trained about in my group courses, but then you can, as somebody who's older, you can do yoga. You could do chair yoga, you're like really getting older.
100%.
Like, right? Yeah. There's so many variations. And that is what I found just personally. Like, as I've gotten older, I used to do Orange Theory, not like every day, but like my body was like too much. And, like I've kind of transitioned to like Pilates and yoga sometimes and things like that. So
100%.
So that makes so much sense because I just, like you're like touch head. That's so, like, why are we doing these things? Right. Like that's where the yoga piece, I think that's why your CEUs will be like, oh, this is so cool. Because so many people have a more naturalistic lens where we're trying to be like, this is important for so many other things instead of this one randomized skill. And why are we working on that?
Exactly. Which it is an important skill. Like, don't get me wrong. Like you totally have to be able, like, there's a lot that goes into that. Right. Seeing the person, it's kind of like joint attention in a way, and then motor, but sometimes you see it and you're just like, okay, we get it. She can touch her head. Now what? And where can you go from there? So if you're able to do it, maybe kiddo comes into the clinic 5 years old and you're starting to work on this. Now they're 15, they're able to go into a yoga class, and they're not going to be, if you're working on generalization and maintenance the way that, you're supposed to, that skill should maintain, and they should be able to go into that environment, and they should be able to thrive. So yeah, totally.
So let me ask you a question I didn't send over ahead of time. Is that, so have you, because what was neat about when I was doing yoga with the kids, COVID hit. And so then my district was really a savvy district. And so I was like very busy during COVID, like ABA speech was like very busy. My clinical work was very busy. And so at the end of our sessions, we would do yoga, which I thought was neat for the parents to see. Like the parents were like, wow, this is so cool. Have you had people excited about it because it is something different? And have you also felt like you had to advocate for this kind of approach, being a little bit outside of the box?
Yeah. I think you're totally on point when you kind of made that connection there where people will see it and they're like, oh, duh. Like that's totally like, an application, a practical application of the skills that we're trying to teach them. I do feel like generally I'm met with enthusiasm and excitement and kind of like an aha moment that's like, oh, of course we can work on this. On the flip side, do I feel like I'm needing to kind of advocate it? It's tricky because we're in such a, I don't want to say overly structured field, but in some ways it sometimes feels that way because I do think people fear stepping outside of the box, and yoga, if you talk to the wrong person, I mean, even in the last, I don't know, like couple of decades, yoga is on the rise. People are doing yoga, they're accepting it.
Right.
But it is a little bit, not woo woo at all.
Yes.
It's not like,
Right.
it's not like that, but it's a little bit more touchy feely, like I'm in touch with my body and all these things.
Right.
I haven't necessarily had anyone say it to my face. They might say it
Yeah.
behind my back.
Yes. Right.
But I do feel sometimes like I'm, over justifying or, being like, no, this is observable. It is
Right.
measurable. We are
Yeah.
still following the guidelines and all of
Yeah.
the things and
Right.
Cooper and all the,
Yes.
all the things, if you want to be by the book, like we're still
Yes.
doing that.
Yeah.
And you know what? If it doesn't work, just like anything, we don't have to do it.
Right.
So if
Yeah.
you're taking data and you want to measure behavior reduction goals alongside
Right.
the introduction of something like this, and you
Yeah.
notice a spike in behaviors, we can
Right.
discontinue it. We can, we
Right.
can modify it. We can find other coping tools or things like that. But I think it's important to remember that every branch out of every field that has ever happened started with somebody thinking outside of the box. And if we have too
Right.
many people afraid to do that, we're not going to get anywhere. We're going to be living in the early 2000s with all that research forever and ever. Like we have to
Right.
move forward at some point. So I think that would be my biggest thing that, I do kind of fear that people will see this and be like, oh, it's not ABA, it's not ABA, but it is. Like if you're
Yes.
taking it, aside from, it's not teaching specific things that maybe have a lot more research, but let's
Right.
get the research. It fits into the mold enough to get the research, and you can call it experimental or whatever you want, but
Right.
it's people have been using this for 5,000 years, and there's clearly a benefit to it. So
Yeah. I mean, I hope somebody listens. And we had Dr. Amber Valentino come on and talk about clinicians doing research. And so it would be interesting if, you partnered with somebody, did some research and
I would love that.
put
Yeah, I
something
would
in
love to
behavior.
present on
Yeah.
research
Yeah.
or get someone to tag
Right.
team it with me. Absolutely.
Yeah. I'll have to send you that. Because this sounds like a good behavior analysis and practice article.
Totally. Yeah,
That's one of my
absolutely.
I love that publication. It's so like real world, you know what I mean?
Yeah, I'll send it to you when we get it done.
Okay, I love that. So what are the general benefits of using yoga with students kind of across the lifespan? Because you talked about working with older learners, and I worked for 10 years just with middle school, high school, and that is really who I did yoga with, was usually my students in that age group. But what are some of the benefits kind of across the lifespan?
Yeah, I think benefits across the lifespan. I think the younger that you start working on anything, the better that you're going to be. So like my parents put me in violin when I was 3 years old.
Wow.
And yeah, I don't know. And, it's been almost 30 years at this point, and I can read music better than I can read a book. Because I learned to read music first, and I am not like a musician by trade. Recently I hadn't played since before the pandemic. I picked it up and I played it, and I could play it well.
That's
and
cool.
So anything that you learn when you're younger, it's going to follow you and you're going to be better for it. Some of these younger learners might not fully understand
Right.
What it is that you're teaching them, but down the road, they're going to be awesome at it. So I think, you really can't start too young, especially if you're working on some of those kind of silly goals like touch head and things like that.
Right.
But I think as you go through life, whether you're on the spectrum, not on the spectrum, you face other challenges, or you have a perfect life with no challenges. Lucky you.
Yeah.
You develop these skills that you could have kind of in your tool belt if you ever need them. So I mentioned earlier, proactive versus reactive interventions. It's like, if that, like before everything that happened when I first got into the field, if I had a regular yoga practice, I might have recognized in my body that something was going on, and it wouldn't even have gotten to the point where it did. And I would have just breathed into it, and I would have, done all the right things, and I would have handled it 100 times better. So I think you have, in the good times, you have a sense of calm. And then in the bad times, you have a tool that you can use that will really help calm the nervous system and all of the things. And so many of the people that we work with struggle with language, with expression. They have just as many feelings as we do, if not more. They have just as much, frustration, trying, like, I can't even imagine feeling so frustrated and not really being able to ask for anything, and someone's telling you touch your head, like, and you can't even ask for a break or whatever the case may be. And functional communication, you're working on it or whatever, and that helps in the moment. But like, if you were to have something that can help you kind of recenter, recalibrate, I think it's hugely beneficial. So both for our clients, as well as, like I said earlier, so important for clinicians and for parents and caregivers to take care of themselves and find, something that works for them, I think. Can just help you be a better member of our planet, and also better at your job, and more like eager to learn, better at learning, when you're not feeling like that. So
yeah, I love that. And I've had some friends. I think me and my friends, I started this book club like in my neighborhood. I live in a big suburban kind of neighborhood. And so we went to this comedian last month, and we were just chit-chatting. And I think I was just saying like, Pilates, and I talk about it a lot. And so because obviously I do some with my friends, and somebody was saying like, I don't know if we started talking about yoga, but somebody was like, oh, I can't calm my brain, to be able to do those types of things. And I just feel like it does make you feel like your just whole body. Like, I do really love to work out. I think there's something for that for me, just because my parents were always like, let's take a walk. I was like 3. I remember our one neighbor, we were like 6, and she was like, we were at the park and that's what we were doing. And she was like, this is what you guys do for fun? And we were like, yeah, I mean, it's just what we do. You know what I mean? So I think your body, like a body in motion stays in motion. But I was feeling proud of myself, because I was like, well, I have a lot of stressors in my life, but this is like very important to me. Like, should I be going to Pilates at 11, or, I'm going to miss so much work, but I'm like, I know that I'll be so much more productive because I'm carving out this time to do this, or, whatever it is. And I think it can feel so hard to get started. I think the other thing I really like about yoga too, is that is something you can do across the lifespan, but it is something that you could do with like a family member. It's also like, it could be affordable or free. Like, I mean, there are some good YouTube videos that you could do. So
100%.
If money is a concern, or resources, like that Cosmic Kids yoga is a cute yoga.
Yeah, I love that one.
That's like themed and things like that. Or, I was telling you, my occupational therapist just had these really nice OT cards of different poses, but I just went on Google Images and looked up to the different poses with real life pictures, and like made those for the class, and like we'd hold it up and everybody would do the pose. And so it's really like what you want to make it, right?
Exactly. And I have a lot of people say that to me too, like, oh, I could never do yoga. I don't get it. And I felt that way too, I think, before I ever started it. Like it is like kind of a hard thing to get into if your body's not used to that sort of a thing, connecting your breath to your movement. Yeah. And what I will say is, if you're struggling to get into it, you don't even need to start with yoga. I would say 2 things that you can do that will make you feel better, make you feel less stressed, is 1, pranayama, which is breath work. You do, you could even go on YouTube and type in box breathing or whatever, where you inhale for 4, hold your breath for 4, exhale for 4. You do that for 2 minutes, you're going to feel 10 times better. And then the other thing is progressive muscle relaxation, where you just tense each part of your body for like 10 seconds and then release it. If you're feeling stressed and you don't get yoga, or you don't understand it, or you're just trying to get into it, I say start with those 2 things. And when you notice how different you feel and how much more connected you feel with your body, you might want to give it a shot again. Or do like a shorter, like do like a 5-minute yoga session. Pick a one short little flow and do it every morning before you start your day. Like get like a little ritual going. And I mean, it's not something that you're meant to be perfect at, especially not right away. Don't do it for the perfection. Don't do it to do everything right. Just do it and just really be conscious of how it affects your mood and all the things. And like you said, like I try to prioritize fitness and Pilates or yoga like above all else, because I know if I don't go, like I might get more done, but the quality's not going to be as good. My connections with coworkers not going to be as good. All of the things. You're a better person when you have these practices kind of top of mind.
And that's it. It's a practice, right? Like I always like that when I go to yoga class, that this is part of your practice. And I'm like, oh, I go 4 times a year, but I don't know. You know what I mean? Like they always try to modify it and make it. great.
Great.
And okay, that's great. Well, I mean, if you don't want to go out and try yoga, something is wrong with you. So
Exactly.
if you end up trying
Exactly.
yoga, send me an Instagram DM or a LinkedIn message
Yeah.
because I need to know. Well, thank you, Lindsay, so much for coming on. It was
Yeah,
really amazing to
absolutely.
work with you. And then, so where can people find out about you and your work? I know that we'd love to have you maybe, next year come and do a talk for us at the ABA Speech Connection. We have a CEU membership, but you do have
Oh,
a
great.
talk right now on Behavior Live. Is that correct?
Yes. So I have
Okay.
one that is currently already up. And then I'm doing another one May 1st. I wasn't sure when this was going to premiere. So I'll probably
Yeah.
put another one out for June. So
Okay. Cool.
listeners can tune in. So those will be on Behavior Live. They are live CEUs.
Hmm.
And then they're also available asynchronously afterwards.
Yeah.
So if you miss it,
Yeah.
you can totally just tune in after. And then I also just created an Instagram account literally like 2 days
Oh,
ago.
oh my God.
Yeah, because I saw your question. You're like, where can people find you? I was like, nowhere. I'm not a big
Yeah.
social media person. So I'm going to try to figure it out.
Okay.
But yeah, feel free to follow that along. It's wellness interventions, just one word, wellness
Oh,
interventions.
I like that
Um,
handle. Okay.
Thank you. It was
Yeah.
available and didn't need any
Wow.
numbers after it.
That's
So we're
amazing.
going to call it
Wellness
a sign. Yeah.
interventions. Okay, I'll have to
Yeah,
tag you. We'll take a
absolutely.
picture here in a sec. Well, this
Yes.
was great. Okay, we'll visit Lindsay and we'll have you come back in the ABA Speech Connection to do a CU soon.
Awesome. Thank you so much, Rose. Thank you for
Thank you.
inviting me. This was awesome.